Bismillahirrahmanirrahim. Dear students, today we will cover another respiratory disease known as influenza. Influenza in Urdu is known as zukam. Learning objectives of today's lecture include problem statement of influenza, what are its epidemiological determinants, clinical features of influenza, how will you diagnose influenza, and preventive and control measures of influenza. Influenza is a viral respiratory disease caused by influenza virus. Influenza virus is of three types: A, B, and C. All the known epidemics, they are caused by influenza virus A strain. Clinically, this disease is characterized by sudden onset of chills, malaise, fever, muscular pains, and cough. Problem statement. Influenza is truly an international disease. It occurs in all countries and affects millions of people every year. Its behavior is unpredictable and it occurs in several forms. In history, many pandemics occur because of influenza. Mostly occur every 10 to 40 years because of antigenic changes. For example, Spanish influenza occurred in 1918, Asian influenza occurred in 1957, and Hong Kong influenza occurred in 1968. In between the pandemics, epidemics, they tend to occur at intervals of 2 to 3 years, mainly because of influenza A, and after an interval of 4 to 7 years in case of influenza B. Generally, once an epidemic of influenza begins, the picture is quite clear. Initially, there are few cases, and then there is a sudden increase in cases and large number of cases of the disease appear. At the present time, there are three types of influenza viruses. They are there circulating in the world, namely A, containing the genetic makeup H1N1, heme agglutinin 1 and neuraminidase 1, A, H3N2, and B viruses. The World Health Organization global surveillance activities, they have identified the human infection with the new influenza virus called A, having the genetic makeup of H5N1 in Hong Kong in mid 1997. More recently, influenza A H1N1 virus of the swine region emerged in Mexico during the spring of 2009, and it was given the name pandemic influenza A H1N1 2009 virus. Dear students, now we will discuss the epidemiological determinants of influenza disease. First, we will discuss the agent factors. Influenza virus belongs to the family Orthomyxoviridae. Influenza virus is of three types: influenza virus type A, type B, and type C. These viruses, they are antigenically distinct and there is no cross immunity between them. Influenza A virus has two distinct surface antigens, namely the heme agglutinin and the neuraminidase. The heme agglutinin antigen basically initiates the infection following attachment of the virus to the susceptible cells, and the N antigen is responsible for the release of the virus from the infected cells. Humans, they are generally infected by viruses of subtype H1, H2 or H3 and N1 or N2. Compared to influenza virus A, which got subtypes, influenza virus B does not exhibits the antigenic shifts and is not divided into the subtypes. Influenza virus A is basically unique among the viruses because it is frequently subject to antigenic variations both major and the minor one. When there is a sudden complete or major change, then it is known as shift. Antigenic shift basically occurs from the genetic recombination of human with the animal virus, and which provides a major antigenic change, and this major antigenic change causes a major epidemic or pandemic, which involves most or all age groups. And when the antigenic change is gradual over a period of time, it is called drift. In antigenic drift, mostly there is a mutation which is known as point mutation. Reservoir of infection for influenza exist in animal and birds. Many influenza viruses they have been isolated from animals and birds, which include horses, dogs, cats, wild birds, etc. Animal reservoirs provide new strains of influenza viruses by recombination between the influenza viruses of man, animals, and birds. The source of infection is usually a case or a subclinical case of influenza. The secretions of the respiratory tract they are infective. Period of infectivity, virus is present in the nasopharynx from 1 to 2 days before and 1 to 2 days after the onset of symptoms, and this is the time when the case is infective to other people. Now we will discuss the host factors. Influenza affects all ages and both sexes. In general, the attack rate is lower among adults. Highest mortality rate during an epidemic occurs among certain high-risk groups. These are old people, generally over the age of 65 years, children under the age of 18 months, people who are having the pre-existing disease like diabetes, chronic heart disease, kidney disease, or respiratory problems. Human mobility plays an important role in the spread of infection. The immunity to the influenza is subtype specific, means there is no cross immunity. If you get infection against a particular influenza virus, it does not provide you protection against the other influenza virus. Epidemics of influenza usually occur in the winter season or in the rainy season. In the northern hemisphere, epidemics occur in the winter season, but in the southern hemisphere, epidemics occur in the rainy or the winter season. Overcrowding enhances the transmission. The attack rates are high in close population groups, that is, in schools, in institutions, and in ships, etc. Influenza virus mainly spreads from person to person by droplet infection or by droplet nuclei, which are created by sneezing, coughing, or talking. The incubation period of this disease ranges from 18 hours to 72 hours. Clinical features of both the influenza viruses include fever, chills, aches and pains, coughing, and generalized weakness. This fever lasts from 1 to 5 days, averaging about 3 days in adults. There are different complications which arise, which include acute sinusitis, otitis media, purulent bronchitis, and pneumonia. Pneumonia is the most fearful complication which must be suspected if the fever persists beyond 4 to 5 days or reoccurs abruptly after convalescence. Reye syndrome is also there. Reye syndrome, that is fatty liver with encephalopathy, is a rare and severe complication of influenza, usually of influenza type B virus, and it occurs particularly in children. In it, there is rapidly progressive hepatic failure and encephalopathy. This syndrome is usually associated with aspirin use in a variety of viral infection. Dear students, this diagram on the right hand side is showing you the symptoms of influenza, and on the left side there is a list of complications of influenza. Dear students, in this diagram, on your left hand side, you can see the symptoms of influenza virus, and on the right hand side, you can see the complications which are caused by the influenza virus infection. Kindly go through these symptoms and complications. Clinical diagnosis of influenza virus is difficult, except during the epidemics. Laboratory methods so needed to confirm the diagnosis. So this can be done by two ways: virus isolation and serology. In virus isolation, the virus can be isolated from the nasopharyngeal secretions by indirect fluorescent antibody technique, and in serology, ELISA test is done. Prevention of influenza: various attempts and measures have been adopted to control the influenza epidemics, but unfortunately little success has been achieved, and the control of influenza remain quite poor. But still there are few preventive measures which are listed on this slide. Good ventilation of the public buildings, avoidance of crowded places during epidemics, encouraging the sufferers to cover their faces with handkerchief when coughing and sneezing, and to stay at home at the first sign of influenza. These are all the sensible precautions. The vaccine is generally not recommended to control the spread of this disease in the general population. Influenza vaccines, they don't control the epidemics. The vaccines of influenza, they are recommended only in certain selected population groups. For example, in industry to reduce absenteeism, and in public servants to prevent the disruption of critical public services such as the police, fire protection, transport, and medical care. In addition to the different population groups discussed in the earlier slide, there are also certain other groups, for example, the elderly and individuals in any age group who have a pre-existing chronic or debilitating disease. These diseases include disease of cardiovascular system, metabolic diseases like diabetes mellitus, cystic fibrosis, chronic respiratory disease, chronic renal insufficiency, congenital or acquired immunodeficiency, and their close contacts. They are selectively immunized because of the high risk of severe complications, including death. So, people who are suffering from any of these diseases, they should also be vaccinated against the influenza virus. Dear students, for the prevention of influenza, there are two types of vaccines available: killed vaccines and live attenuated vaccines. Killed vaccines can be administered by either subcutaneous or intramuscular route. For adults and children over the age of 6 years, a single injection in the dose of 0.5 ml is sufficient, while children in the age group of 6 months to 36 months of age, 0.25 ml is generally given, while in the person below the age of 9 years and who have no previous immunological experience, then two doses are necessary, which are usually separated by an interval of 3 to 4 weeks. The immunity in case of this vaccination lasts for only about 6 to 12 months. So revaccination on annual basis is generally recommended. There are few contraindications for the use of inactivated vaccines, which are the following: people who have a severe allergy to chicken eggs, people with a history of anaphylactic reactions or other life-threatening allergic reactions to any of the constituent of vaccine, people with a history of severe reaction to influenza vaccination, people who develop Guillain-Barré syndrome within 6 weeks of getting an influenza vaccine, children who are less than 6 months of age. In this age, generally the inactivated influenza vaccine is not recommended, and people who have a moderate to severe illness with fever. These people should wait until they recover to get vaccinated. These are the few contraindications in which the inactivated vaccines should not be given. In case of live attenuated vaccines, a trivalent live attenuated influenza vaccine can be administered as a single dose in the form of intranasal spray. It is approved for use in individuals between the age groups of 2 to 49 years. Dear students, as already described that the vaccines have limited efficacy, after vaccination immunity lasts for only 6 to 12 months. So antiviral drugs they have also been tried for the prophylaxis and therapy of influenza infection. There are two drugs which have been tried, zanamivir and oseltamivir. These are basically the neuraminidase inhibitors and they are used both for the prophylaxis and therapy of influenza A and influenza B. This concludes our today's lecture. Thank you very much.